Hello everyone, hope you're all doing good. In this video, we are going to discuss about adenomyosis. So let's see what is adenomyosis first. Adenomyosis is presence of endometrial tissue in the myometrium that is at least 2.5 millimeter from the basal layer of endometrium. Okay, so we know uterus has 3 layers, right? So we have the endometrium, the myometrium, and say the perimetrium. Okay, so what is going to happen is this endometrial tissue is going to be present in the myometrium. Okay, so that is adenomyosis. And remember, for this, these glands should be found at least, okay, at least 2.5 millimeter depth from the endometrial layer. Okay, I hope you would have understood what is adenomyosis now, right? So, this adenomyosis can be diffuse or focal, and it can also be asymptomatic, mostly found incidentally, or it can be found after hysterectomy also. Okay, mostly after hysterectomy. Okay, and in some patients it can be symptomatic as well. So, asymptomatic adenomyosis is seen in 60% of the females, whereas symptomatic adenomyosis is seen in 8 to 10% of the females. Okay, let's see the pathogenesis of adenomyosis. Number 1, it can occur due to invagination of basal endometrium into myometrium, or there can be metaplasia of the Mullerian nest. Okay, so these are the 2 causes by which adenomyosis can occur. And while doing investigations in an MRI, you will be able to see a myometrial zone and then a junctional zone that is defined at the innermost layer of myometrium. Then there can be disturbances of this normal junctional zone that predisposes to secondary infiltration of endometrium that includes both the glands as well as the stroma of the endometrium. That you have to understand. Okay, glands as well as stroma into the myometrial zone. Clear? Right. Now, let's see what are the causes for adenomyosis. So, causes may include endometrial factors that can happen due to any genetics or autoimmune conditions, or there can be trauma to the deeper endometrium. Okay. So, at what condition this stroma to the deeper endometrium can happen? Yes, when there is a repeated curettage. Clear? Yes. Now, what happens means the surrounding myometrial tissue undergoes hypertrophy as well as hyperplasia, and this will give rise to uterine enlargement. Clear? Right. Now, let's discuss about the pathology of adenomyosis. So, how will be the gross appearance? Okay. So, gross appearance of adenomyosis. When there is a diffuse adenomyosis, you will have uniform enlargement of the uterus. Okay, there is uniform uterine enlargement. Then you will have a thickened myometrium. Foci of hemorrhage can be seen. Then diffuse adenomyosis is one of the common presentation of adenomyosis. Clear? We can also have localized adenomyosis. It is also called as adenomyoma. Okay, it is also called as adenomyoma. So, here there is no capsule or plane of dissection, and this can protrude into the cavity as submucous adenomyoma or adenomyomatous polyp. Clear? Right. And when you see the size of uterus in adenomyoma, usually doesn't increase more than 12 to 14 weeks. Okay, maximum size reached will be 14 weeks of gestational age only. Okay, and it will be corresponding to the 14 weeks of gestational age. Okay, so that is the maximum size it can be reached. And while doing cross section, you will be able to see thickening of uterine wall as well as trabeculations as well. Clear? Now, this is one picture of adenomyosis where you are able to see the hypertrophy of the myometrium, and these are the tiny cystic spaces. Okay, I hope you are able to see. Okay, so these are the tiny cystic spaces that are representing the endometrial glands, right? Fine. Now, let's discuss how will be the microscopic appearance in case of adenomyosis. When you see microscopic appearance, yes, definitely the endometrial glands and stroma are found in the myometrium. Okay, and then these areas can reveal so many changes in them that will include either proliferative hyperplastic or secretory changes. Clear? Yes. Now let's see what are the clinical features that this woman will present to you. Clinical features can include secondary dysmenorrhea, which is mainly due to prostaglandins, and there can be retrograde pattern of uterine contractions as well. Okay, can happen due to local tissue edema. Then there is increase with depth of infiltration. Okay, right. And other than this, it can also present with heavy menstrual bleeding. So, heavy menstrual bleeding, or otherwise it is menorrhagia. Okay, so menorrhagia. So, this is one of the most common type of presentation in which 70% of the women will present to you. So, here it happens because there is increased uterine cavity surface, endometrial hyperplasia or seam. Then there is inadequate uterine contractions because there is distortion of the uterus. Yes, there can be dyspareunia as well, and there can be increased frequency of micturition, as well as some of the women can also present to you with infertility. Okay, so why infertility in patients with adenomyosis means there is interference with sperm transport. Second point, there is interference with blastocyst implantation, and you can also have abnormal endometrial immune response. Clear? Right. Now let's see what are the signs of endometriosis that you will be able to make out. I already told you, yes, there is going to be a uniformly enlarged uterus, and it can be just palpable abdominally, and remember the maximum uterine size it can reach will be 14 weeks. So, most of the times it will be less than 14 weeks only. Clear? And I'll tell you one more thing importantly. The age group of these women will be mostly above 40 years. Okay, and they will be Paris women only, and as I told you, most of them are asymptomatic. Clear? Right. Let us see the investigations to be done in a case of adenomyosis. Okay. So, investigations, we have to start with transvaginal ultrasonogram, Okay, so where you will be able to make out asymmetrical uterine wall thickening, then myometrial cysts, which will be hypoechoic, and this can be seen in a honeycomb appearance. There is increased vascularity within the myometrium, and finally there is loss of a clear endometrial border. Okay, so these are some of the features that you will be able to see via TBS in adenomyosis. Okay, there is asymmetrical uterine wall thickening, there is myometrial cyst which will be hypoechoic, which will be giving you a honeycomb appearance, there will be increased vascularity within the myometrium, and there is loss of clear endometrial border, right? Okay. The next investigation which you can offer them is MRI. MRI is more specific, and if it is more than or equal to 12 millimeter junctional zone thickness is seen, then it can be suggestive of adenomyosis. Clear? Right. Now let us see how we will manage a case of adenomyosis. So treatment, let's see medical treatment first. You can give NSAIDs. Okay, so this will be controlling pain and bleeding. Second one is levonorgestrel IUD system. So this will improve heavy menstrual bleeding as well as dysmenorrhea as well. Then GnRH analogs also. Okay, so GnRH analogs causes reduction in the uterine size as well as the volume, and this can be used prior to the surgery so that you will be making the surgery easier. Okay, right. Now let's see what are the surgical mode of management of adenomyosis. So surgical mode of management include, you can go for a conservative management, okay, by using resection of adenomyoma. But remember, this is possible only in a case of, yes, localized adenomyosis or adenomyoma. Clear? Then you can go for myometrial reduction. That means you can go for partial resection of the uterine walls. Clear? And the next one is hysteroscopic endometrial resection. Endometrial resection that is performed via a hysteroscope. Okay. So this is possible for submucosal or polypoidal lesions. And finally, you have some interventional techniques that may include endometrial ablation, uterine artery embolization, and MRG-FUS, which is nothing but MRI guided focused ultrasonogram. Clear? Yes. So, this is uterine artery embolization. Okay. So, these are some of the conservative methods in surgical management. And finally, if you go for proper surgical management, you can offer them, hysterectomy. Okay. So, hysterectomy can be offered, but you should know when you should offer them hysterectomy. Okay, what are the indications? Indications will include when they are of perimenopausal age group, there is poor response to medical therapy, and when the adenomyosis condition is associated with other pelvic pathologies. Okay? Yeah. So, we are done with adenomyosis. I hope now you would have known what is adenomyosis, what are the causes, how it should be diagnosed, how it should be medically managed, symptomatic management as well as the surgical management, right? So, until we meet in the next video, keep going happy learning and take care. Bye.